Understanding giant cell arteritis. An overview. Giant cell arteritis, or GCA, is a serious medical condition that causes inflammation of the lining of your arteries. This condition can be quite debilitating and requires immediate medical attention. This inflammation, also known as vasculitis, primarily affects medium and large arteries, particularly those supplying blood to the head, neck, and arms. The swelling can cause a range of symptoms that can significantly impact daily life. While the exact cause of GCA remains unknown, it is considered an autoimmune disorder, where the body's immune system mistakenly attacks its own healthy tissues. This misguided immune response leads to the inflammation and damage of the arteries. GCA most commonly affects individuals over the age of 50, with women being 2 to 3 times more likely to develop the condition than men. This demographic trend highlights the importance of awareness and early detection in older adults. It is crucial to understand GCA because, if left untreated, it can lead to severe complications such as vision loss, stroke, or aortic aneurysm. These complications can be life-threatening and drastically reduce the quality of life. This inflammatory process can restrict blood flow, depriving vital organs of oxygen and nutrients. The reduced blood flow can cause pain and other symptoms that can be difficult to manage. The consequences can be severe, affecting vision, brain function, and overall health. Early diagnosis and treatment are essential to prevent these serious outcomes. Understanding the symptoms, diagnosis, and treatment of GCA is paramount in ensuring timely intervention and preventing irreversible damage. By raising awareness and promoting early detection, we can improve the prognosis for those affected by this challenging condition. Recognizing the warning signs. Symptoms of GCA. Giant cell arteritis, or GCA, often manifests with a constellation of symptoms that can vary significantly from person to person. This variability can sometimes make it challenging to diagnose early. Some of the most common symptoms include headaches. New onset headaches, often severe and localized to the temples, are a hallmark of GCA. These headaches can be debilitating and may interfere with daily activities. These headaches may be persistent or come and go, and can be accompanied by scalp tenderness. The scalp may feel sore to the touch, making it uncomfortable to brush hair or wear hats. Jaw pain. Pain in the jaw, particularly while chewing or talking, known as jaw claudication, is another characteristic symptom. This pain can make eating and speaking difficult. This pain arises from reduced blood flow to the jaw muscles. The discomfort can be intermittent or constant depending on the severity of the condition. Vision problems. GCA can affect the arteries supplying blood to the eyes, leading to vision disturbances such as double vision, blurred vision, or sudden, painless loss of vision. These visual symptoms can be alarming and may progress rapidly. Fever and fatigue. Many individuals with GCA experience flu-like symptoms such as fever, fatigue, and weight loss, even in the absence of an infection. This general feeling of being unwell can significantly impact quality of life. Recognizing these symptoms early and seeking medical attention is crucial for managing GCA effectively. Early diagnosis and treatment can help prevent serious complications, including permanent vision loss. Unmasking the culprit. Diagnosing giant cell arteritis. Diagnosing giant cell arteritis can be challenging, as its symptoms often mimic those of other conditions. A thorough medical history, physical examination, and a battery of tests are usually required to confirm the diagnosis. Blood tests, elevated inflammatory markers such as erythrocyte sedimentation rate (ESR) and C-reactive protein (CRP) are common in GCA. Temporal artery biopsy. This procedure involves removing a small sample of the temporal artery, a blood vessel located in the temple, to examine it under a microscope for signs of inflammation and giant cells. Imaging tests. Ultrasound, magnetic resonance imaging, MRI or positron emission tomography, PET scans may be used to visualize the affected arteries and assess the extent of inflammation. The importance of early detection temporal artery biopsy. While blood tests and imaging can provide valuable clues, the gold standard for diagnosing GCA remains the temporal artery biopsy. This procedure is crucial because it provides a definitive diagnosis, allowing for timely and appropriate treatment. Early detection and treatment are vital to prevent serious complications such as vision loss or stroke. This minimally invasive procedure allows doctors to directly visualize the affected artery and confirm the presence of characteristic inflammatory changes. By examining the artery, doctors can identify the hallmark signs of giant cell arteritis, ensuring that the patient receives the correct diagnosis and treatment plan. During a temporal artery biopsy, a local anesthetic is used to numb the area around the temple. This ensures that the patient remains comfortable and pain-free throughout the procedure. A small incision is made and a section of the temporal artery, typically about 1 inch long, is removed. This small sample is crucial for the pathologist to examine and make an accurate diagnosis. The incision is then closed with sutures. Proper closure of the incision helps to minimize scarring and promote healing. The biopsy sample is sent to a laboratory, where it is examined under a microscope by a pathologist. This detailed examination is essential for identifying the specific characteristics of the inflammation. The pathologist looks for signs of inflammation, such as the presence of giant cells, which are large cells formed by the fusion of immune cells called macrophages. Identifying these cells confirms the diagnosis of giant cell arteritis, allowing for targeted treatment to manage the condition effectively. Section 5. Navigating treatment options, corticosteroids and beyond. Once a diagnosis of giant cell arteritis is confirmed, prompt treatment is essential to reduce inflammation and prevent complications. Corticosteroids, high doses of corticosteroids such as prednisone, are the mainstay of GCA treatment. Corticosteroids work by suppressing the immune system's inflammatory response. Tocilizumab. For individuals with severe GCA or those who cannot tolerate corticosteroids, tocilizumab, a monoclonal antibody that targets a specific inflammatory protein, may be used. Methotrexate. In some cases, methotrexate, another immunosuppressant medication, may be added to the treatment regimen to reduce the required dose of corticosteroids. Section 6. Living with GCA long-term management and outlook. Living with giant cell arteritis often involves long-term management to control inflammation and prevent relapses. Regular monitoring is essential. Regular follow-up appointments with your doctor are crucial to monitor your response to treatment, adjust medication dosages as needed, and manage any potential side effects. Lifestyle modifications are also important. Adopting a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques, can improve overall well-being and support your body's healing process. Support groups can be incredibly helpful. Connecting with others who are living with GCA can provide emotional support, practical advice, and a sense of community. Section 7. The power of awareness. Early diagnosis for better outcomes. Early diagnosis and treatment are paramount in managing giant cell arteritis and preventing severe complications. When diagnosed and treated promptly, most individuals with GCA experience significant improvement in their symptoms and can prevent irreversible damage. However, delayed diagnosis or inadequate treatment can have devastating consequences, including vision loss. Inflammation of the arteries supplying blood to the eyes can lead to permanent vision loss if not addressed promptly. Another serious risk is stroke. GCA increases the risk of stroke due to the increased risk of blood clot formation in inflamed arteries. Section 8. Seeking expert care. Finding the right specialist for GCA. Managing giant cell arteritis often requires a multidisciplinary approach involving a team of healthcare professionals. Rheumatologists, specialists in autoimmune and inflammatory diseases, are typically the primary physicians involved in the diagnosis and treatment of GCA. Other specialists who may be involved in your care include ophthalmologists, eye doctors who can monitor your vision and manage any eye-related complications of GCA. Neurologists are also important, specialists in the nervous system who can assess and manage any neurological symptoms or complications. And lastly, vascular surgeons, surgeons who specialize in treating blood vessel disorders, who may be consulted in cases of aortic involvement or other vascular complications. Section 9. Conclusion: Your health, your priority, understanding GCA. Giant cell arteritis is a serious condition that requires prompt diagnosis and treatment to prevent potentially life-altering complications. By understanding the symptoms, diagnostic process, and treatment options for GCA, you can take an active role in your healthcare and advocate for timely intervention. If you experience any of the symptoms associated with GCA, it is crucial to seek immediate medical attention. Early diagnosis and appropriate management can significantly improve outcomes and preserve your quality of life. Remember, your health is your priority, and knowledge is power when it comes to managing your well-being.